Bone stress injuries are common in endurance athletes and they're incredibly frustrating. And often, endurance athletes tell me they feel like they came out of nowhere. They'll present to me with a bone stress injury and say, I didn't increase my mileage that much, or I was training really consistently. And the really frustrating thing is that these things can be true, but you can still develop a bone stress injury. Now, in this episode, actually, this is part 1 and part 2, and I am joined by the wonderful Lauren Nash, also known as Dietitian. So welcome, Lauren.
Thanks so much, Kate, for having me. I'm looking forward to it. Obviously, not only for the people that listen to it, but for me as well, because like we'll get into, bone stress injuries are kind of the talk of the town at the moment. And I think it's great for everybody's knowledge, whether you're a health professional or a novice or an elite runner. So I think that this is going to be a really great podcast. And we're obviously going to be able to chat about how multifactorial it is as well, because I think sometimes on social media we only see, maybe one side of it. So thanks so much for having me and sharing your time and your thoughts with me as well.
Excellent. And that's exactly why I have you, because like you touched on, we know that bone stress injuries are so multifactorial, and we're going to go through that in depth, obviously. And I'm going to look after the biomechanical training load kind of side of things. We've got you for the energy availability and the nutrition side of things. So our listeners are going to get the most holistic, hopefully, aspect of this from two professionals in the field, which I feel like hopefully everyone coming out of this is going to be super equipped with all of the knowledge that they need. But first of all, and I've seen so much of this on social media, I guess, because there are a couple of prominent influencers who are experiencing bone stress injuries at the moment. They've shared it and it seems to have just blown up. And one of the most common things that I have seen, though, is people asking, saying, and I've had a few people ask me, say, Kate, bone stress injuries seem to be, or stress fractures seem to be very prominent at the moment. Are they more common? And I'm going to start by, I guess, giving my perspective, Lauren. And I'd love to know yours from a dietitian nutrition point of view too. But I must say, I am very lucky in my industry. I work pretty much purely just with endurance athletes, and I haven't seen an increase in incidence of them. I think that there's an increase in the presence of influencers and running on social media, and I think that gives the and there is obviously a big increase in participation rate. So maybe my viewpoint as a clinician is biased by, I have lots of long-term clients that I've worked with for many years, and maybe I do have that bias there, but I haven't seen an increased incidence. I have always, unfortunately, though, seen a high prevalence of bone stress injuries in endurance athletes. So I wouldn't necessarily say the increase is there, but they've always been prevalent in my opinion, and from what I've seen clinically. And research supports that too. They can account for up to 20% of running-related injuries. And that's been research that's shown that for a long time. I just think there's more awareness and more talk about it. But what's your viewpoint? Do you feel the same? Are you differing to me?
Yeah, really good point. And I'd say I'm actually probably on both sides, because I think naturally I have seen actually an increase probably in the last 12 months for me with the amount of people I am seeing for, return to run, those types of things. But I am also working a bit more closely with a physio clinic here in Perth. So I'm lucky enough that the team is getting a lot better at referring on. So I would say that I'm seeing a lot more of it in person, because they're also proactively getting treatment during their rehab, and also, yeah, as they're returning to run. But I also agree with you in a sense that I think we just live in an age where there's so much more accessibility to share information or to share our stories. So I think people have always been having bone stress injuries, but they've probably never had the platform to talk about it as much. And then it gets shared, and then it's everyone's conversation at post run club coffee. Oh, did you see this person got a stress fracture? So in a way, it's probably a positive, because hopefully it's just going to bring people's awareness up, I suppose, in terms of, oh, okay, maybe this isn't actually a niggle I should ignore. Maybe it could progress to something worse. So I would say, I think it's probably more the accessibility of information, but I would say I have definitely seen an increase probably in the last 12 months, and predominantly in runners, not necessarily say the triathletes. So I'm sure we'll get into that. But yeah, I'd say I do more so see it in runners specifically.
Yeah, okay, super interesting. And I want to start this pod episode off by, first of all, acknowledging that the terminology around bone stress injuries is very confusing. And this is really hard too, because there was even a 2025 expert Delphi consensus study that was all of the experts in bone stress injuries. They all acknowledged that there is a lack of consistency when it comes to the terminology around bone stress injuries. So you'll hear words like stress reaction, stress fractures, hairline fracture, fatigue fracture, bone marrow edema, and all of these terms get thrown around. And then especially if you add social media into the mix of that, where you have athletes who, by no ill intent, but they're using words interchangeably that may not mean the same thing, or maybe they have a stress response, not a fracture, but they've used that. And this is absolutely nothing on them, because like I said, even the expert consensus paper acknowledged that it is very, very confusing. So I wanted to just first start by saying that this episode is on bone stress injuries. And a bone stress injury is just an umbrella term for injuries that represent overuse injury to the bone, okay? And these occur when they are, when there are repetitive mechanical loadings. That's generally that impact, that loading through the bone. And when that exceeds the bone's capacity to remodel and recover, leading to structural fatigue and local bone pain. And they are not acute injuries. So it's not like you've just slipped off a curb and broken your lateral malleolus. I don't know what, that sounds pretty dramatic, but they are load related, just to be clear here. They're load related, they develop over time. And like I said, they are very prevalent, but I do also want to acknowledge that, and I found this early on when I was a physio too, that I used to get a little bit confused about the presentation of bone stress injuries, because we know they are load related, we know they are chronic, they develop over time, but more often than not, athletes just present with, I went on this one run and I felt it on this one run, and they don't see all the sort of warning signs, which is what, Lauren, you and I are going to go over. But it almost feels like it can present as an acute injury. Is that, in your experience, Lauren, of what you've kind of heard as well from athletes that you work with?
Yeah, definitely. There's some that really are ticking all the boxes in terms of they've got coaches, they've got physios, and then they start thinking, oh my gosh, was it the day I changed my shoes? Yeah, again, not my area. I usually see people once they've had the stress fracture.
Yeah.
But from what they tell me, obviously during that initial assessment, is there was just this one run where they started feeling this pain, and it doesn't seem to be a gradual pain, like, for example, maybe a tendinopathy or, some other type of overuse injury.
Yeah. And I want to quickly go over pretty much what you just touched on there, like how they start to accumulate. And it's interesting you say about the footwear. I always find athletes go, oh, it's because I changed my shoes. I'm like, oh, no, that unfortunately was not the key thing here. We could blame it as a contributing factor, but that ain't it.
Yeah.
Trouble is, though, is that these are small changes that happen quietly. And this is where I really want to point out to athletes. I always find that when athletes come to me, they get this almost wave of these guilts, and they're like, what did I do wrong? And they start to feel really bad about all these things. They go, how did I miss these training load errors? How did I not pick up on this? Or how did my coach not pick up on this? But often these are really small changes, and they slowly, or like I call it, like quietly increasing the skeletal load. So these can include things such as slight increases in intensity. So it might even be that, every week maybe they do 6 times 1K at threshold with 60 seconds easy in between. And then maybe they've bumped that up to 8 times 1K and then 10 times 1K. And that might be too quickly amongst the other things that they do. Higher density of sessions is something that I definitely see and highlight, because our bones need that mechanical load, because that's how they get stronger and how they adapt, just like all other tissues. But when this is too close together, it doesn't give the bones then that time to actually adapt. So sessions that are just too close together, and this can be a scheduling thing, especially for really busy athletes, that they just might need to cram in that extra run after their long run day. And then the day after that one is like their intensity day. And those three things, are too much in a small space. Fewer true low load days. Now, I did do episode 2 was on recovery runs and not recovery runs. And I do find that people, even on their lower load or like even their rest day, they'll do a recovery run, but that's still impact, and that doesn't give the bones a chance to recover. Or easy runs where they're not recovery runs, they're actually easy runs where they just are not easy anymore. And this is where I would always say to athletes, I've even done this myself, because even though I'm doing this pod with you, Lauren, and I know all this stuff, I still, if I run with people or if I know what's going on Strava, I'll run faster than I should. And I know better. Actually, do you know what? No, that's a lie. I don't do that anymore. But I turned my Strava off because I'm like, no, I know. Woo!
Yeah. Wow. Proud.
Not because I don't feel like I can control myself. Now I can. I'm always that one hanging at the back, and I go, you can beat me in training, I'll beat you on race day. That's fine.
Yeah.
But I don't like comparing other people's easy runs to mine, because it makes me feel slow, and reduced recovery. And that includes the nutritional component as well, Lauren, which we've got your expertise in here. But I'm going to just flick through a little bit of this background
For
first, and then
sure.
we'll delve into it a little bit more. And often when we look at these things in isolation, they can seem really small and insignificant. But if you have a couple of these factors or enough of a change in one factor, and you put them together, you're going to change how much load the bone is exposed to. And that's going to stress it out. And the other thing that I find that athletes say to me a lot is they'll go, but my friend who's doing the same program as me is totally fine. And I'm like, I know. And that's because every athlete is different and their bone metabolism is different. It's individual, it's multifactorial. And athletes, even with lower training volumes than their friends or anyone else that's even of the same level of them, can still develop those bone stress injuries. Even if their loads are lower, because they may have an impairment in their bone capacity or that turnover state. So that's why bone stress injuries aren't just as simply as, oh, well, you did more. Like, it's not that easy. From your perspective, Lauren, what are the things that you would sort of point out here as to things that may alter that bone metabolism kind of side of things for each individual from a energy availability perspective, or maybe history of that as well? What's your kind of input there?
Yeah, good question. And I think, again, right, like you said, it's never usually an obvious kind of change. It's not just going to be, one day of a bad diet is going to lead to a stress fracture the next day. And you made a good point, even in the question, is it a history of, and I can always maybe share a bit of like a case study that I've had recently, which I think, again, present day stress fracture, very big history as to, okay, where this could have come down the line. But I think one of the biggest things is a lot of people, especially, for example, in their 20s and their 30s, they haven't always been runners or they haven't always done triathlon. They've maybe come from, say, a gym background, or maybe they do, F45 a couple of days a week. And how you need to eat to fuel maybe one 45-minute gym session a day versus then doing multiple sessions per day, people unintentionally just don't simply eat enough, or they don't quite realize how much more they now need to eat to account for the multiple sessions per day, the 1 hour run that is easy, but is still an hour of quite strenuous activity. So I would say a lot of the time it's never intentional. I think it's just people not simply understanding how their nutrition does need to change. And again, on a podcast, I can't just sit here and say everybody needs to eat X amount of calories or X amount of grams of carbohydrates, because like you said, everybody's bone repairs and builds at a different rate. Everybody requires a different amount of nutrition as well. So I'd say the biggest problem, especially people that are getting into running or building up their load, or potentially following a program that's not right for them, is that increase in load and not aligning with an increase in nutrition is already starting to create a little bit of a hole. And we can talk about, low energy availability, but short term, might result in a little bit of weight loss, which feels great. And then people kind of keep that going because they want to get to their race weight. And then it, starts to kind of cause a cascade of problems as well. So I would say ultimately the biggest thing is just simply not quite eating enough for your training. But we also live in an age where you speak to anyone and almost everyone is lactose intolerant, a dairy allergy, plant-based, vegan, just doesn't like dairy because they heard on a podcast it was inflammatory. And ultimately, dairy is such a great source of calcium, and calcium is so important for our bones. Ultimately, our bones are just calcium. So I think there's also a big movement in terms of a lot of people just simply not eating enough calcium in their diets. Of course, you can have almond milk or you could have coconut milk, but they're not always fortified with calcium as well. So I sometimes find one of the bigger gaps is, again, people with food allergies or intolerances that don't know how to make up for that lack of nutrition in another way, coupled with kind of just classic diet culture, misinformation on social media, causing people to restrict things like dairy or like carbohydrates without a proper reason, not realizing that these are nutrients that our bodies really need to support training, specifically things like running.
Yeah, okay, that's really interesting. I hadn't really thought about the diet culture side of things. I used to be lactose intolerant as a child, and
Yeah.
I just hate the texture and taste of milk. To me, I think it's the most revolting thing in the world. But I'm aware of that now, and I'm like, oh,
Yeah.
okay, I will like force myself to have some yogurt and dairy-based products, because I'm just like, oh, do you know what? Ice cream, that's my thing now, actually. Over my pregnancies, I was like, yep, ice cream is it.
Yeah.
Now, I want to touch on this case study that you said, just really briefly, because I do try to keep these episodes short, but I knew having you on in this topic, it's not going to be short, listeners. It's not going to be
Yeah.
extra extravagantly long, but the factors that do influence the bone metabolism that, like you said, as adults kind of catches up on us.
Mhm.
And it can be things that we did when we were younger, right? Or a history of what we've had that then is going to determine what we can tolerate load wise in our training later. Could you
Yeah.
really briefly touch on that case study so listeners can get a bit of an idea of the difference between maybe like themselves versus someone else? So,
Yeah.
not that we're comparing, but it's just to
Yeah.
identify the difference, the individual difference that we all have to consider for ourselves.
Yeah, for sure. And I'm actually going to group it because I've had two, both females as well, in a very similar situation where present day, very conscious, have coaches, they have very good training load, kind of no recent history of, say, any injuries. But then when you spend a little bit of time unpacking during, say, late teens, early 20s, there was a period of, say, disordered eating and or very high training load, strict coaches, those types of things, and simply kind of ignoring the flat red flags of, say, missing periods, because again we've come a really long way, but there are still GPs that you'll go to and you'll say, hey, I actually haven't had my period for, I don't know, 2 months, 3 months, insert whatever period of time, and they'll say, oh, do you exercise? Oh, it's normal for an exercising female to lose your period, and it's definitely common, but it's not normal. And I think because, for example, these cases, probably 10 to 15 years ago, this was more of the scene. It was just overlooked at the time. And I suppose during those years, you would know, I guess it's kind of between our 20s and 30s, we achieve that peak bone mass or peak bone density. So when you're under eating or you say over exercising, just not eating enough, that places a huge strain on our hormones, so things like estrogen and testosterone, which can then impact and I guess inhibit bone modeling as well. So you might not have a stress fracture at the time, but because you're impairing your body's ability to actually reach those really strong, stable bones earlier in life, fast forward a few years, placing some additional strain in terms of high training load, maybe still not correcting those eating habits that were never addressed probably earlier on, can sometimes lead to, I guess, that risk for bone stress. And then despite doing something well in the present, again, it just goes to show, okay, maybe the foundations weren't quite strong from the beginning. So I think, yeah, a big sign that's always overlooked is kind of the period side of things, unfortunately, in young female athletes. And again, it's kind of nice, right? Oh, cool, don't have a period. Doctor says it's fine. No worries, might not look into it further.
Yeah, I definitely, when I was in my peak of triathlon, it was almost like a lack of better terms, like a title that you wore. Well, I don't get my period, so obviously I'm training really hard. And it was almost like obviously back then even I knew that wasn't right, and I didn't fall in that category, but that was the general kind of vibe around it, that it was a normalized thing, and it's kind of scary. I'm definitely showing my age now saying that, but it's then
Yeah.
those athletes are going to pay for that now, and that's the really hard thing. The other thing that I do want to pick up on too is that this isn't even have to necessarily come from disordered eating. It can come from your sporting background as well. So, in terms of the athletes that I see, I take extra caution in training load management with my swimmers. So, those who grew up swimming as a child, and because it is obviously very high energy expenditure, but even that aspect aside, unless they did a form of weight bearing exercise, that bone health and that tolerance of the bones to handle load now, such as running. So I see a lot of high level swimmers go from high level swimming into triathlon, and then they struggle with getting bone stress injuries. And I don't know Lucy Charles's history personally, but she has that background. Obviously, she did get into triathlon in her early 20s, and she obviously has worked on that so much, but she initially had a couple of stress fractures. And I wonder if that was from her background of being such a high level swimmer. And the hard thing when you're high level swimming, you're swimming so many Ks, you don't have time to go for a run or like do a bone loading exercise. Your coach would say to you, that's detrimental. That's going to use more energy. No, you're not doing that. So that's definitely another sport that I do pay a lot of attention to, as well. And cyclists is the other one
Yeah.
too, obviously, because it's non-impact.
Yeah.
So they are just examples for our listeners of you need to think about you. And unfortunately, that bone health turnover where we improve our bone health substantially and build that good foundation is generally by the age of 25. So I always ask athletes, what did you do when you were younger? What your sport? And they kind of look at me and they're like, well, I'm 50 now. I'm like, I know.
Yeah.
Trust me, this matters. Yeah, it is important. I'm not just being nosy. So, and I also want to touch on that bone stress injuries do happen on a continuum. So I do want to explain this to listeners as well. So as that stress accumulates, your bone injury is going to develop along a spectrum. So you first have this initial imbalance between the damage being done to your muscles and the remodeling. So when we have that imbalance, and that's fine, that is how our bodies remodel and they get stronger. That's an important thing. But you start off with this slight imbalance first. You're not going to have any symptoms, but then you get an accumulation of this damage, and then that results in a stress reaction. And if that's not managed appropriately, that then turns into that stress fracture, which can, in a worst case scenario, turn into a complete bone fracture, which I have seen a neck of femur complete bone fracture before. Yeah, and that's next level, and that's the athletes who will say, it hurt, but I wanted to keep training through it, not knowing obviously what they had there. But I do think that's important just to explain that bone stress injury continuum, because that then also helps with the confusion of the terminology. So a stress reaction is the level before that stress fracture, before the complete bone fracture. But even before that, you can just have a bone stress injury that is just an imbalance between the damage and the remodeling. And that still obviously counts as an injury. But sometimes you don't have the symptoms there, or it's very dull and diffuse that it's easy to just be mixed up with some general muscle soreness as well. So I did want to point that out there in terms of the, I guess, bit of background on it.
Kate, earlier you mentioned a lot of people say to you, it was just this one session where I felt the pain. Like you said, it doesn't necessarily slowly accumulate. What are some risk factors for developing a bone stress injury? I know I made a comment before, people say, oh, it was my shoe. But obviously that's probably not the case. So for people to be better, I guess, informed, what would you say, or what do you see as being the biggest risk factors for someone developing a bone stress injury?
Yeah, and this Delphi consensus study actually summarized this list really nicely. It is a big list, and I'll pop a link to this study in the show notes as well, because it's open access. But here are some of the key ones that they agreed on as key factors. So transitions in training load, and that really is just like the key there. Previous bone stress injury is a big one as well, and we'll delve into that why soon. Low bone mass or bone health, and the trouble I find with this is that athletes often don't know they have low bone mass or low bone health until they have a bone stress injury. Then they might have a DEXA scan and go, oh, hang on. So this one can be really hard unless you know that. Insufficient energy intake, which I'm going to circle back to you, Lauren, and because I feel like the next one's menstrual dysfunction, and low testosterone also in males. Do you know what? I'm going to get you to talk over those three before I go on to the next couple, which are a little more physio-y. So could you explain those ones to me, please, Lauren?
Yeah, for sure. And I think as well, right, we kind of probably mentioned before, energy intake is so important. And of course, when you're talking to the masses, I can't say every runner needs to be consuming, 3,000 calories, because that's going to be so incorrect. But ultimately, right, one of the biggest risk factors from a nutrition perspective as to why someone might end up with any type of injury, let alone, bone stress specifically, is if they're in a state of what we call low energy availability, LEA. You probably have seen it or read it or heard it from an influencer, but it's important to understand what that is. And, low energy availability shouldn't be confused with calories in, calories out, in terms of, kind of that bodybuilding side of things, where it's just simply how many calories we're eating versus how many calories we're expending. Because
Okay,
yeah,
can you
yeah,
clarify why not? Because I'm sure there's so many listeners right now going, well, then what is it then? What is low energy? Why is it not as simple as that? Can you please, I'm so excited for this, Lauren.
for sure. Yeah. So what low energy availability is it's when an individual's calorie intake is insufficient to support both our daily living, so ultimately maintaining homeostasis, and the demands of exercise output. Because at the end of the day, our homeostatic responsibilities and just day-to-day functions that happen just laying in bed or sitting down are things like reproductive function, so getting ready to have a period, creating bone, breathing, growing hair, all of those types of things. Plus then we've got exercise, whereas a lot of people think, I only need to have calories when I'm exercising, not realizing that our basal metabolic function also requires a lot of energy every day. So ultimately, LEA occurs when we consistently don't have enough energy coming in from our diet to fuel both that basal metabolic rate and our exercise output as well. So ultimately, it kind of leads our body to become this little battery saving mode. I think a really good analogy someone once told me was when your phone gets to 10% battery and it says turn on low power mode. Ultimately, our body starts to do the same, and functions such as reproduction, digestion, bone remodeling become not important in the moment, because, hey, I know I've got to go out the door for a 20K run. The body needs to preserve the energy for that exercise. So we start to see physiological functions shutting down. And that's why, like you just mentioned, things such as menstrual dysfunction and changes in our hormones can occur because our body is really in a state of such stress that it doesn't have quite enough fuel in the tank to keep us functioning optimally as well as training optimally. And the reality for, high performing athletes is you need to eat for your training, of course, but you also need to eat for your short and your long term health because ultimately underfueling or low energy availability is what underpins REDS, so relative energy deficiency in sport. And that's not just as simple as, say, weight loss, which is kind of where the calories in, calories out response comes from, because someone might be in a state of low energy availability, but not losing weight. Because what our metabolism is doing is it's trying very hard to maintain that energy balance. And it can often lead to things like fat accumulation because it's trying to hang on to as much energy as possible. And it's often overlooked because people always assume, well, if I wasn't eating enough, I would be losing weight. And in the short term, that happens. But with chronic low energy availability, our body ultimately is trying very hard to do what it can with what's coming in. And we start to see bigger problems like, changes in menstruation, loss of libido in both sexes, increased injury risk, all of the types of things a high performing athlete doesn't want, purely because there's been that big chronic energy deficit over time.
Okay, my mind is exploding with questions with you. So we're going to focus on these next couple of points for the rest of this pod ep because I think this is so important. So many things that you've said. So when athletes come and see me, and if I've sent them off for a scan for a bone stress injury and it's been confirmed, okay, and I'll go, okay. And I'll say to them, we need to chat training load. And then I always tie it in with a talk about energy availability. And I'll always ask them that side of things. And the response I get from so many of them is they say to me, but Kate, I haven't lost weight. Like, look at me. And I'm looking at them. I'm like, yeah, you look good. Like, what do you mean? Look at me. And to them, they're like, but I've actually put on weight. How can I be in this low energy availability if I have put on weight or if I'm not skinny as a beanpole? Because this is, I think, what people have the trouble with low energy availability and understanding if it's them or not. So before we even delve into other symptoms, can you no, you already explained that concept, but I guess that's what you're saying, right? Is that it doesn't have to be associated actually with weight loss.
Yeah, definitely. And I think as well, I don't mean to keep comparing it to just simple weight loss, but I think that's what we're more conditioned to learn about. Even anybody, for example, even a bodybuilder that's going on a weight loss journey, weight loss is never linear. Say, for example, you're following a nutrition plan and a training plan. You might see weight loss for maybe 2 or 3 or 4 weeks, and then it's going to plateau because your body has now adapted to that energy intake that's coming in. And now we need to change things up. So, in a sense, that is kind of what's happening there. And the body is really just trying to hang on to as much energy as it can, meaning it won't, I guess, start cutting into, say, our muscle stores. We've obviously got a lot of fat there, so we can use fat as energy. But I think this is why people will make those comments to you, is because it's a really great way to disguise things like low energy availability or REDS, especially in individuals that maybe do have that history of disordered eating, because food intake and exercise is very closely tied to their self-worth and how they see their body. For example, if they're not losing weight, they're either not training hard enough or they're not eating in a way that's promoting a deficit. Whereas sometimes, right, any type of stress is impacting our, say, cortisol, our energy availability. So whether it's over exercising, it's under eating, it's psychological stress from work, ultimately the REDS consensus has been updated over time. And an interesting, I guess, comment that was made, I think, in 2023 in the most recent update was, potentially it's not just energy availability causing REDS, and it's just chronic stress from a whole as well. And it's just, more of a perspective. But I do think that is very important because, as you would know, right, whether it's psychological or it's physical, we love exercise, but it's still a stress on the body. So ultimately, increased cortisol, decreased cardioprotective hormones like estrogen in women, like testosterone in men, starts to then impact our hormone health, our mood, our sex drive, because naturally our body's like, hey, we don't have enough energy to grow a child, so we're going to reduce your sex drive anyway because we don't have the energy to do that. And that's where we see things like loss of morning erections in male athletes, and also menstrual problems short term, fertility problems long term in female athletes.
Yeah, okay. Well, this is such helpful information. So there's the obvious with the missed menstrual cycles, especially 3 consecutive menstrual cycles. But what would be some of the symptoms for athletes? Because obviously also, a lot of the time, the low energy availability is unintentional. And there are so many other factors. And I always point out to them, how's your sleep? How's your stress? What are the big life changes going on? Try and have a chat again without being super nosy, but I try and get as much information as I can out of the athlete about all these other factors. But what are some other symptoms that you would flag, or questions that you would ask, or that our listeners could maybe ask themselves with the removal of the like loss of the menstrual cycle, or the decrease in the um, morning glory? What's it called? To
I guess,
layman.
yeah, I don't know the technical lingo. Mine was a bit obvious, wasn't it? But,
No,
yeah,
no,
sex drive.
this is yeah, decrease in sex drive in males. Like besides those, is there anything kind of before that? Because to me, they're kind of like your, oh, okay, we're really not going great in the energy availability side. What are some other symptoms beforehand that you pick up on?
Yeah, for sure. So I guess one of the biggest ones is just, that chronic fatigue and low energy, kind of no matter how well you sleep or if you take a rest day, I think just that accumulation of constantly feeling tired. And it's hard saying that because, being tired could be from a multitude of reasons. Maybe you're low on iron, maybe you had a really stressful week at work, maybe your child came into the bed at midnight and didn't get out. So again, it can make it a very non-specific symptom. But if you're consistently feeling tired, you don't have the motivation to go to training, to finish your sessions, you're not progressing, you're not hitting different metrics, you're seeing changes in even, say, maybe resting heart rate. You're not recovering as well from your training sessions as well. You've got, extended, I guess, DOMs or just really low energy after your training sessions could be a big one. Insomnia as well, because ultimately, right, if you're not eating enough, that kind of keeps you awake at night, and then you have a poor sleep, then it leads you to overeating. So it can mess up, I guess, with your hunger hormones as well. And even things as well, such as just decreased capacity. A session that should be easy or you should be able to say hit in 45 minutes, it's actually taking you a little bit longer, or the strain seems so much higher relative to how it felt 2 weeks ago. So I think just feeling as though you're plateauing in your training can be a big one as well. And again, yeah, probably decreased mood, maybe changes in this, I guess, the psychological side of things as well. So maybe being a little bit more introverted, not feeling as interested or excited for your training. And again, probably just brain fog. So all of these things really just tied to, say,
Yeah.
low food intake.
Yeah, okay, interesting. And other factors outside of that energy availability also include functional strength deficit. So this may be just for athletes, especially in a single leg sport like running. So if you do have, for example, excessive hip weakness and perhaps contributing to knee valgus or any sort of form of that, for lack of better terms, like poorer biomechanics in impact exercise like running can contribute. The early sports specializations, like we touched on before, definitely highlighting that. Low vitamin D and calcium. And I'll definitely get your intake on that in the management in the next pod episode on your thoughts on vitamin D and calcium, if they need supplements, or how you could take it in
Yep.
directly through your diet. Footwear changes, that was in there, but let's be clear, everybody, that ain't the key. Biomechanical factors, like what I touched on with those strength deficits, I find they often go hand in hand. One thing on that biomechanical factors, again, these are often things that you don't know that you have a weakness in. And this is where stress fractures do creep up on people and they go, but this isn't fair. I didn't know these things. And then afterwards they realize they have them. And this is where I really want to remove like the guilt around stresses, because it's so hard to know this. I found out not too long ago I have some focal cartilage loss in my knee, and I think it's from all my rowing days, just excessive knee flexion all the time, and it's in a
Yep.
weight bearing part of my knee. So I just have to be really aware of that, because that would put me at higher risk of a bone injury. So if I never had pain there, I would never even know that. So, it's just these things that often we don't know, and you can't beat yourself up about them, but they do unfortunately play a role, and sometimes we can't modify them. Being a female, the experts agreed that that did put you at higher risk of having a bone stress injury. So shame for you and I there, Lauren. Low body mass index as well, low BMI was another factor too there. And again, athletes don't often see these things coming. They might not even realize they fall into that. I do often find athletes go, do you know what, Kate? Yes, I had symptoms of low energy availability, but also I was training a lot. I was training for an Ironman. Of course, I'm going to be tired. I was training for an Ironman. I was working full time, and I've got a child. And they're like, oh, I'm just tired. And it is really hard, like you said, I think, to differentiate between those things and know where is the line. And yeah, it's hard to always recognize that. So I think these are subtle things that are hard to recognize, but they're often things in hindsight that we have, or that maybe sometimes we need someone else to point out for us, which is where people have us.
For
So
sure.
for this episode, I guess Lauren and I just wanted to really reframe bone stress injuries. The important thing is to highlight areas that we often didn't know that needed attention, and these are the things that do contribute to these injuries. We want to clarify what a bone stress injury actually is. In the next pod episode, Lauren and I are going to go through really helpful tips on how we can actually manage them and how we can prevent them from, or minimize the risk of them happening again. So we are going to chat about that. Do you have anything else, Lauren, that you want to add in for this episode, or a couple little takeaways for listeners?
Yeah, I would actually say, like you've just gone through with a couple of the risk factors, I would say if you're sitting here listening to this episode, or just, even in training or across your weeks, I sometimes think if you're asking yourself, am I eating enough? Or, am I underfueling? I would say that in itself is a very deeply covered up sign that you are not eating enough. And I've seen it consistently with clients as well. Pretty much 9.9 times out of 10 people who make those comments and come and see me, they have been underfueling for a very long time. Now, intuitive eating is obviously not something everyone has the power of doing. Just because you say, I need ice cream doesn't mean your body does. But if you are undertaking quite a lot of training and you're consistently asking yourself, oh, actually, I don't know if I'm eating enough, or, those types of things, yeah, reach out to someone, do your own reading. You don't have to come and see me, but use that as a cue that it's probably your body trying to really promote, I guess, a bit of self help there. And one other final comment would just be, it wasn't listed in your risk factors then, but just something that I would see, and again, it's probably not scientifically backed, but just an observation I have seen in practice. And you would have seen, actually, I did a post on it the other day, is sometimes gastrointestinal conditions, for example, Crohn's disease, IBS, celiac disease, any type of condition relating to the gut where we see reduced nutrient absorption can also be a risk factor for any type of bone stress injury, because unfortunately, we're not able to absorb things like calcium, which means you might be eating a really high calcium diet, but actually not absorbing any of it, or maybe a really small part of that. So if you're a listener and you do have something like celiac disease or Crohn's disease, just keep that in mind and make sure that you are eating in a way that supports your gut health. And that can obviously be a completely different episode in itself, but it really is multifactorial. It's not just as simple as overtraining or undereating. It's, yeah, all of these background things that, until you don't know, actually impact your bone health.
Yeah. Lauren, I'm going to put you on the spot because I have one question that, again, I just hear this so much from athletes, but with the intuitive eating, or I loved what you said of, if you're asking a question, am I eating enough? It's probably a sign you're not. I find that athletes say to me, I know I should probably eat a little bit more, but I don't want to put on weight because that's then going to increase the load on my bones when I run because I'm going to be heavier. What would your response be to someone who would say that to you?
Yeah, that's a really good question. And it's a hard one to answer, but I think it's really important that we remove ourselves from that narrow minded approach that eating is purely something that causes us to increase or lose body weight. Eating is so much more than just what it does to our weight. It's how we recover, it's how we have energy. And I sometimes feel like a more positive way, to help people feel more comfortable or see the benefits of eating more is, in a sense, if you're eating a little bit more, you've got more energy. When you have more energy, you've got more energy to put into your training. You're probably going to have a better training session. You're going to burn more energy because you can push harder. And as a result, it probably all balances itself out in a sense that you're eating more, but you're also able to output higher levels of training duration and training intensity. The benefits that come with eating more in moderation, of course, always outweigh that. And again, I always see in clients that say have had that chronic underfueling, once they are eating more, we actually sometimes see them lose weight, because it circles back to that low energy availability comment, where when our body is constantly under stress, it's very, very unlikely that it's going to let any of that body weight go because it's trying to hang on to it for energy. So sometimes the best thing you can do if you're trying to achieve a race weight is actually make sure you're eating enough in the first place.
Yeah. And I say exactly that to people who are training for a marathon. They say, I really want to get to race weight. I'm like, your race weight will take care of itself because you're going to increase your training load. You're going to increase your intensity. You just have to make sure you're eating enough. And I promise you, your race weight will take care of itself. The race weight is the weight that gets you to the start line healthy and having done all your training sessions. There is no better weight than that weight. And they're like, oh,
Absolutely.
well, hang on.
Yeah, I agree.
Wonderful. Okay, well, Lauren, thank you for your time today. And we are going to get on to episode number 2, or part number 2 of this particular series. Thank you.
Thanks, Kate.